Hi, this is Courtney Austin presenting my critical thinking assignment for Nursing 686 Advanced Practice in Primary Care 2. Today we'll be discussing PM, who is a 70-year-old African-American male in the office today for a routine exam. He has an allergy to penicillin and his current vitals are a BP of 130/86, his heart rate is 88, his SpO2 is 98% on room air, and his temperature is 98.8 degrees. Although he is here for a routine exam, he has mentioned to us that he has been having difficulty since his wife passed away 6 months ago. He has a history of diabetes with a current A1C of 7.1%. His previous A1C was 6.7%, but he does report that his blood sugars have been running between 120 and 160 at home. His exercise habits are intermittent and his diet has been okay, although he hasn't been eating a whole lot at home, he reports. He denies lightheadedness or excessive sweating and reports his feet will occasionally tingle at times, although he denies any trauma or injuries to his feet. He is tolerating his metformin well, but does need a refill. He has a history of hypertension and high cholesterol, and today his BP is 130/86. He does state that he does not check his blood pressure at home, but denies any feeling of dizziness, lightheadedness, or headaches. He is followed by Michigan Heart for his hypertension and high cholesterol and has a follow-up appointment with them on October 28th. As far as his increased sadness, the patient reports his wife passed away 6 months ago, and he hasn't really had any interest in social events since. He does not have children or extended family, and he feels lonely all by himself. He states he does not leave his house and reports he thinks he's lost a bit of weight because his pants are loose. He denies any self-harm thoughts or suicidal ideation, and he does report a positive history for depression. Like previously mentioned, his past medical history includes type 2 diabetes, hypertension, and high cholesterol, and with a reported history of depression. His current medication list is a baby aspirin, metformin, atorvastatin, and hydrochlorothiazide. His pertinent family history includes his mother, father, and maternal grandmother having diabetes, his mother and paternal grandfather having lung disease. His father had hypertension and heart disease, along with his mother and father both having hyperlipidemia. His paternal grandfather passed away of lung cancer, and both of his parents are deceased. PM lost his wife 6 months ago due to COVID. He and his wife did not have children and kept to themselves. He retired more than 5 years ago and reports he didn't really have any hobbies. He would just fiddle around the house most days, but his wife kept him company. He denies nicotine use, will drink on occasion, but not in excess, and denies any illicit drug use. Today, PM reports his pants are loose but unsure of weight loss, reports poor appetite and fatigue, but denies any weakness, fever, or chills. He reports increased feelings of sadness with no desire to socialize, feels tired and has no energy to perform daily tasks, but does not have a solid support system. His physical exam shows the patient is alert, however, appears withdrawn and tired. Other than the reported symptoms, there are no positive or acute changes on his physical exam. Considering PM's history of depression and the recent loss of his wife, along with his symptoms, PM is diagnosed with major depressive disorder. The American Psychiatric Association defines depression or major depressive disorder as a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Depression is not a normal sign of aging. The Geriatric Mental Health Foundation states depression is a serious illness affecting approximately 15 out of every 100 adults over the age of 65 in the United States. If depression occurs in late life, it is typically a relapse to a previous episode. However, if there is no history of depression, then typically late life depression is caused by a medical condition. His treatment plan is as follows. PM's A1C was slightly higher than the last visits. However, it is still in an ideal level. His blood sugars have also been ideal, and so he will continue on his current metformin dose. He is encouraged to exercise and monitor diet for excess carbs and sugars. He was instructed to keep his cardiology appointments since they monitor his hypertension and cholesterol, along with prescribing his HCTZ and Lipitor. For his increased feelings of sadness, PM will be started on Wellbutrin. He will start at once a day, and then if tolerated, after 3 days, he will be increased to twice a day. A referral to a therapist is recommended to PM, but he is refusing a referral at this time. Along with initiating medication for his diagnosis of depression, PM will be referred to our local PACE program. Huron Valley PACE provides coverage for primary and specialty care, prescription drugs, medical transportation, hospital visits, dental care, medical equipment, home care, as well as physical, occupational, and speech therapy, and other services. They also provide opportunities for social interactions, recreational activities, monthly outings, and educational classes. It is simple to refer a patient. All you have to do is call the outreach program and provide them with a few details of the patient. They will then reach out to the patient and set up a time to meet them in their home to finish documentation and the appropriate paperwork needed. The patient will then tour the facilities where the last step takes place. The last step includes an individualized plan of care being made, which is tailored to the patient and his needs, which in this case is social interaction. Goals for PM in the short term are for him to start being proactive in his mental health. This can be initiated by him making daily small goals for himself that can be easily achieved. This will lead the way for bigger goals to be achieved. He will start his medication and be compliant with the regimen. He is educated on the fact that the medication needs time to build in his system, and he should start to feel some relief in the next 2 to 3 weeks. He's also educated on the importance of notifying the clinic or seeking medical attention if he has any increased harmful thoughts or thoughts of suicidal ideation, because this medication can have this effect during the beginning weeks of treatment. He will also be set up with PACE, and a short-term goal is for him to comply with them and try to put himself out there socially. A long-term goal is for him to continue his medication regimen. Once established in his system and the benefits are being observed, he may think it's okay to stop the medication. He's educated on the fact that the medication should be continued even though he is feeling better. Another long-term goal is for PM to fully utilize PACE's program, make friends, and participate in the social events they provide. Having a support system is important, especially while still grieving his wife. He is encouraged to work on his mental health and staying active. Also, continued encouragement for PM to speak to a therapist will be provided. Thank you.